So, hello, I'm Dr. Kurtz from Vitality Healthcare, your medical and natural healing center. Today I'm going to be talking about a patient here who complains of tightness and spasm from her right hip all the way up her right side of her spine up into her neck. She does a lot of driving and attributes the symptoms to that. And today what I'm going to demonstrate is how we can fine-tune and tailor chiropractic adjustment to relieve the spasm using a central approach, central being from the central nervous system, primarily the brain and cerebellum. So I'm going to demonstrate a couple tests here. First is a muscle test from triceps, so push towards me. Now the right side is weak. I'll do here, push towards me, and this one is much stronger. Now what typically happens is if we're right-handed, what can happen is we do lots of things with our right hand, but not so much with our left. This gives a lot of input to our left side of our brain, but not so much to the right. So we'll end up with is a little bit of an imbalance. And what happens is that the brain functions like a brake for muscle tone. And what happens is when that becomes dysfunctional or less functional, we get a pattern like this where all the flexors in the upper arm get tight and short and actually pull our shoulder forward. And then also in the hip, we're going to get tightness here in the hip external rotators, which is going to pull our foot out like this. So sometimes we'll walk actually with our toe out like this. Okay, so let's do a couple more tests here. So we're going to go straight out and we're going to turn like this. Okay, faster. There we go. Now we can see the difference. The right hand is clearly faster than the left, and this is a cerebellar test, so this is going to point to the left side of the cerebellum, the left cerebellum. Okay, so that's one of our tests. Now, if we have you lay down on your back, we can do a foot turn-in test and test the external rotators of the hip. So when we, just relax, when we turn them in, we're going to see here that this right foot does not turn in as far as the left. It's probably hard to see on the camera, but what we're seeing is we're seeing the right foot turn in less than the left. Okay, that would indicate a tight external rotator of the hip. Okay, now lastly, my toothbrush. Here's my toothbrush. Okay, so I'll have to cut that out. Okay. So now I will demonstrate how we can stimulate the right side of the brain. Okay. This pattern is indicative of a left cerebellum and a right cortex problem. Okay, not to get too complicated with neurology, but basically the right side is weaker than the left. And what we're going to do is we're going to take this toothbrush, which functions like a tuning fork, and she's going to hold on to it with her left hand. Okay, so just let that work for a minute. Okay, this is giving input. Now vibration actually skips the cerebellum, goes right to the cortex, but that's for me to know and you not to worry about. So as we're doing that now, we can come back to our foot turn-in test. And now our feet are even. Okay, so that means the feet are coming in symmetrically. Okay, we can go back to our weak arm here, our weak triceps. Push towards me. And this is much stronger. Here. Okay, now what's happening here? The toothbrush is stimulating the right brain, which is then working like the brake that it should for these muscles, and it's relaxing these muscles, which is making the inhibition in the extensors here much less. And so it's much more symmetrical. Okay, so we can take this away. Now, this is one input, but how long does that last? Well, if she gets up and walks around, it's going to come right back. So the strongest mechanical input we can give to the nervous system is actually a chiropractic adjustment. Therefore, we're going to do that. So let's have you lay on your right side. Okay, so actually let's lay on the left. The other side. Sorry. You want the right side. Okay, now she's got tension all the way through here, all the way up through the neck. So what we're going to do is we're going to do a quick stretch of those tight muscles. And by doing a quick stretch, the brain's going to shut off the muscle and therefore decrease the spasm. So this, here, so. Exactly. Okay. So now all I'm going to do is a quick little adjustment here. Take a breath in and let it out. And just a little stretch like that. We get a nice release. Good. Let's lay on the back. Okay. Now, usually when we give an input, we want to, when we're adjusting a joint, okay, that was a stretch for the muscles. When we're going to do an adjustment to a joint, we want to tailor it to be on the left side because it's going to come up the left side and go to the right brain. So, very simply, I'm going to do a left-sided rib. So hold on there. There's usually a rib that's stuck, sticking out right here. Bam. Take a breath in and out. I'm just going to lightly adjust that. There's another good release. Okay, excellent. And then we're just going to look at the neck here. And my adjustments are very quick, but not forceful. Speed is more important than force for the adjustment. Okay, so it appears we've got a problem here. So we've got a big problem right here. So I'm going to give an input on the left side of the body again to stimulate the right brain. We're going to come across. Okay, just relax. It's just a quick little, like that. Good. Okay. Now, the vertebrae itself is moving much better. We gave another good input to this brain here. Okay. Now, I'm going to go through quickly and stretch out those spasm muscles, which are all through here. So that are wrist flexors, our biceps. And then on the other side, it's the extensors that are tight. So we'll do the extensors here and here. Good. Now, when we come back to here, push towards me. We're very strong here. This is good. And the feet are symmetrical, and they stayed symmetrical after the stress. Okay, let's have you sit back up. All right. Now we'll go and do our test like this. So full range of motion and nice and fast, fast, fast. Full, full, full. There you go. Now that's more symmetrical. That's good. That means our cerebellums are working symmetrically. Now we're coming back to the shoulders. Now before this shoulder was here because this pec was tight. Now as I go to this point, it's much softer and she's not jumping as much. So that's a good sign as well that this pattern is now relaxing. Okay, so to summarize, her symptoms included spasm coming from her hamstrings to her hips on the right side of her spine all the way up into the right side of the neck. And so when a patient comes to me and says, I have problems all along one side, whether it's a right knee and a right hip, or a right knee and a right shoulder, a right neck and a right glute, or something like this, I want to check this central approach to see if indeed there is an imbalance in the brain function. Okay, I'm Dr. Kurtz from Vitality Healthcare. Thanks for watching. Tschüss, auf Wiedersehen, and have a great day.